September is Prostate Cancer Awareness Month, so we're going to make ourselves more aware right now. We've got Dr. Matt Johnson. He's a urologist at Aurora St. Luke's Medical Center. Doctor, thanks for being here.
And thank you for having me back.
Difficult topic for guys to talk about, as you know, but let's start with when men should get screened and what that process is like.
So the screening recommendations right now have changed somewhat. It's the years of screening have been limited to 55 to 69, according to current guidelines, but it can be longer for those who have symptoms or those who have a primary relative who had prostate cancer and some other additional risk factors. But for the usual guy, PSA blood test, which is just a blood test, and an evaluation and discussion with their doctor. Yeah. Perhaps, and we recommend, or I believe in rectal examination too, is effective at screening for prostate cancer, and can often find prostate cancer earlier, which is the most treatable, time for, discovering the prostate cancer. Treatable meaning, they'd have lots of options usually. Right,
and we'll talk a little bit more about that as we move along, but obviously early detection, really important key. Let's talk about screenings a little bit more, and in terms of who should get screened when. You say it's a conversation that men need to have with their doctors because there can be other risk factors. Say you had someone in your family, right? If you're already concerned about cancer, it can't hurt you to get screened early.
No, and I think the key here is that you want to, the men should have regular examinations and discussions with their physicians. That means they actually have to have a physician. We know that 75% of all men's office appointments with doctors is made by their spouse or significant others. Right. And so men are notorious for not going to see a doctor ever, so that discussion has to happen. And then if there's something that changes about how they're urinating or something they're noticing, or they have discovered that their dad or brother had prostate cancer, they should have that part of their discussion with their primary doctor.
Your field is changing all the time. There are always new ways to treat cancer. Can you talk about some of the things? I know you're doing some things with robotics at St. Luke's that are really groundbreaking.
Oh, this has been a home run, I tell you. Since '03, we have been doing, we changed our surgical platform completely from open surgery to robotic surgery, which is a very specialized and unique laparoscopic tool. And we can remove the prostate in a couple hours, overnight stay in the hospital, and fewer side effects, pretty streamlined return to normal activity in their life, not so much time off of work, and excellent oncology results, meaning that we're getting it, patients are doing well, they're cancer-free, most of them. If they're not, then there's additional options that we can offer them. So it's been great. It's been a great 14 years. We've done thousands of cases. Dr. Leonovitz and I did the first one in Wisconsin in November of '03, and it's been terrific.
Well, you can't treat people who aren't there, so hopefully this encourages some more folks to get out there and get screened. Thanks, doctor. And